Hello, my name is Josh. I'll be a student nurse practitioner assessing you today. Could I have your first and last name?
Sarah North,
Nice to meet you, Sarah. And could I have your birth date?
5579.
Alrighty. So what's been going on today? What brings you into the office?
I've been having pain in my abdomen and my stomach, my belly.
How long has it been there for?
2 days.
Okay. And is it right in the center of your stomach or where specifically?
Right side, right lower.
Right lower side?
Yeah.
Okay. How would you describe the pain? Is it kind of a sharp pain, a dull pain?
It's a dull aching pain.
Okay. So dull aching pain in the right lower quadrant for a couple of days.
Mm-hmm.
Does anything seem to make the worse or better?
No.
Does it seem like it's getting worse or just kind of steady?
I'm more nauseous now.
Okay. Have you had any loose stools by chance?
No.
Any fevers that you know of?
I felt like I maybe was a little warm, but I never checked my temperature.
Are you currently on any medications at home?
Just something for my heartburn. So omeprazole, Prilosec.
And then have you ever experienced any pain like this in the past?
No.
Any family history, medical history of any disorder?
My mom had her gallbladder. No, nothing else.
Have you had any surgery? Do you still have your gallbladder appendix?
I do have my gallbladder and appendix. I had a C-section.
Okay.
2 of them, actually.
Have you had any dysuria, any burning with urination,
No.
difficulty with urination?
No.
Okay, so since this is technically a telehealth visit, so what I'm going to have you do is, let's assume you were laying flat for this. I want you to kind of press on your right lower quadrant. And if you press on your right lower quadrant, does that produce pain?
I press here. Yeah, that.
Press on your left lower quadrant. Does any pain occur on the right side when you do
A
that?
little bit, but it hurts more on the right.
Okay, what if you, assuming you're still laying flat, if you were laying down and you had your right leg kind of flexed up and then medial to your body kind of flexing in? Okay. And then, so once again, knowing this is telehealth, do you have a set of vitals you could give me?
Let me go see if I can grab blood pressure cuff and thermometer.
I know that's kind of hard when we're not in an office setting like this.
Okay, so my temperature is 99.9.
Okay.
My blood pressure is 140/80. And my pulse is 72.
No difficulty breathing, chest pain, anything like that?
No.
Okay. So off of what Sarah is telling me at this point, kind of sounds like classic symptoms of appendicitis. She still does have her appendix. So that would be my leading diagnosis at this point. So some differentials that I would want to think of, maybe potentially like an ovarian cyst or something, endometriosis. And we would want to exclude a peritonitis, some things that we would not want to miss. So at this point, I would recommend her to go into the ER. So the ER workup, if I was in that setting, what I would want to do, I'd want to do a CBC just to check for an elevation on her white count, her hemoglobin and hematocrit are stable. I would like to do a CMP as well. And then I'd like to do a lactic acid just because we want to make sure that she's not potentially septic if this is a peritonitis or an appendicitis, which I'm assuming it is. At that point, I would want a surgical consult so they could come down and evaluate her as well. And then NPO, of course, at this time, in case we did want to perform surgery, if it was appendicitis, potentially have the appendix removed. And then we'll provide some IV hydration as well. We'll say at this time, saline, we'll give her a bolus of normal saline, a liter, and then run her at 125 an hour after that. She's not necessarily febrile at this point, so I do want to keep track of the temperature. And then another reason that I want the CMP as well, I want to send her down for a CAT scan of her abdomen with IV contrast. I just want to make sure that her kidneys are actually able to clear the contrast when we do that. So based off of that workup, I suppose we could throw a CRP in too as a lab diagnostic, although that's not necessarily specific for appendicitis, just shows inflammation anywhere. And I suppose we could do a sedimentation rate as well. But at this point, with the symptoms that Sarah's given me, I would recommend that she go to the ER and that we perform this workup here to determine if it's an appendicitis, if she needs surgery at this time, and then potentially IV antibiotics too. So I think I would recommend at this time, just since it is an abdominal issue, nothing that's necessarily pointing to vasculitis for me. We haven't had any issues with bowel movements, no straining, nothing like that. So probably I would recommend IV Zosyn. We'll start her off with a 4.5 gram loading dose, which would go over half an hour or so, and then we would follow up in another 6 hours with the 4.5 gram infusion. I think based off what Sarah has given me, I'm going to diagnose her with an acute appendicitis at this time, and then we will further confirm with our ER workup. And my differentials are going to be peritonitis, possibly an ovarian cyst. I guess we could throw UTI in there as well. And that's where I'm going to direct the workup from here. Thank you for your time.